I'm going to show you how to do a hip eval. Okay, hi, my name's Carly. What's your name?
Kayla.
Alright, I'm going to help you out today. Can you start by telling me what happened?
I was playing basketball and I fell on my hip and it just really hurts.
Just really hurts? How long ago did this happen?
This happened about yesterday.
Yesterday, alright. Do you have any previous injury to this leg, this hip, or this leg at all?
No, not that I know of.
No.
I haven't, no.
Have you changed the surface you're playing on? Like you said you play basketball. Have you been running outside or on a treadmill or anything?
I go to the gym, so I run on a treadmill there.
Okay. Have you changed your shoes at all?
No.
Do you run in different shoes than you play basketball in?
Yeah.
Okay. Is your menstrual cycle normal?
Mm-hmm.
Okay. On a scale of 1 to 10, how bad is your pain?
I'd say it's probably around a 6 right now.
A 6, and is that just like a constant pain?
It hurts more when I play.
When you play, does it decrease after you're done playing?
Mm-hmm.
Okay, so I'm going to go ahead and take a look at you. So can you stand up nice and tall for me and go ahead and put your hands on your hips just like this? Okay, and then will you turn around for me? So right now I was just looking at her ASISs to make sure that they were equal. And then can you turn around? And we'll look at the PSIS to make sure that they're equal. And then go ahead and turn back around. And then we'll look for angulation of the femoral head. So we'll look to see if her toes are pointed into coxa valga, so that'd be an increased angle in the femoral head, or coxa vara, which is going to be a decreased angle in the head. And then we'll look for torsion, so if her toes are in, anteroversion, pigeon-toed, or if they're out, retroversion, duck-toed, duck-footed. Okay, and then go ahead and sit back down for me. So we'll look at the hips and make sure that there's no obvious deformity, bruising, or swelling, and then go ahead and lay back for me. And we'll look for a leg length discrepancy. Nice socks. Thanks. So we'll look at her medial malleoli and see if they're even or not. And if there is a difference, then we'll have her bring her legs up into flexion. Make sure that they're even when they're here. And then we look from this way to see if one leg is higher or not, to notify if the leg length discrepancy originates from the femur. And then we look from this side at the tibial tuberosities to see if it's more of a tibia discrepancy. Okay, so now we go ahead and palpate some structures. So if you could stand up again for me. We'll look at her ASIS here, back into her iliac crest, and then turn around, back into her PSIS again, and then, turn around again for me, and then her greater trochanter. Can you go ahead and move your leg back and forth? So we look at her greater trochanter, and then we'd make sure that there's no pain in the quad muscles, so your VMO, vastus medialis, vastus intermedius, rectus femoris, and vastus lateralis. We could look down here, the IT band, make sure that there's no tightness there, and then if you roll over, we could look at her hamstring muscle group, so her biceps femoris, and then her semimembranosus and tendinosus, and her tendons right there. Okay, so now we're going to check your neurological standings. And so we're going to check all of her neurological findings bilaterally. So we'd start up here with her dermatomes and make sure she has feeling in L1, L2, L3, and then L4, L5, S1, and S2 up the back of her leg. And then to test those, we test them bilaterally. So we'd start with hip flexion to test L1 and L2, resisted, and then for L3 we'd resist knee extension, and then for L4 we would resist dorsiflexion, L5 we would resist great toe extension, S1 we'd resist plantar flexion, and then S2 we would resist knee flexion. And we make sure to do all of those bilaterally and make sure that there was no pain or tingling or anything. And then we could also check her reflexes. So right here, we would check our patellar reflex, which indicates L2 through L5. And then back here, her Achilles tendon reflex for S1 and S2. So if everything's good there, we'd move on to range of motion. So can you stand up for me? And go ahead and turn to the side. And so we'd have her bring her knee up for hip flexion, and we would measure that normally to be about 120 to 130 degrees. And then if she brings her leg back, keeping her torso straight, we measure hip extension, which would normally be about 10 to 20 degrees. Okay, and then go ahead and sit down for me. To do hip internal and external rotation, we measure from the knee. So if you can bring your leg in for me, this would be hip external rotation, and there you're going to have about 50 degrees normally, and then the opposite for hip internal rotation, we'd have about 45 degrees normally. And then if you can lay down for me. To measure abduction and adduction, for abduction we'd have her bring her leg out here and we'd measure, and that would normally be about 45 degrees. And then if we have you lay on your side for me, and then bring this leg up so you're down like this, and then for adduction we'd have her bring this leg up here and we'd measure, and normally that would be about 30 degrees. So that'd be range of motion, and then from range of motion we'd go into some manual muscle testing. So we'd start with the iliopsoas, and range of motion was done bilaterally, as well as manual muscle testing is going to be done bilaterally to make sure there's no differences. So we'd start with resisted hip flexion for iliopsoas, right there. And then we would do the external rotators. So we're going to resist here her internal rotation of her knee, but external rotation of her hip. And then for her quad muscles, so to isolate them individually, we'd put her foot into external rotation and have her extend her knee for the vastus medialis, and then we'd have her foot go into neutral and extend the knee for the intermedius and the rectus femoris. And then we'd have her foot go into internal rotation with knee extension for the vastus lateralis. And then can you go ahead and lie on your stomach for me? For the quad muscles, we're going to bring her, the hamstring muscles, we're going to bring her knee up, and we're going to start with her foot in external rotation, and we're going to have her bring her knee to her butt. And here we're bring your knee to your butt, please. And here we're testing the biceps femoris. And then we move into internal rotation, and we'd have her bring it up again for the semimembranosus and the tendinosis. And then same thing here now for the glutes. So for the glute maximus, we're going to have her extend her hip against our pressure. So bring your leg up. Okay, and now can you lay on your side for me? And so for the glute medius and minimus, we would resist her abduction motion. So go ahead and lift up against me. There you go. So that's manual muscle testing, and that was all done bilaterally to make sure everything's even. So now we're going to narrow down what's wrong, and we're going to go into some special tests. So if you can lay on your back for me, we're going to start with Faber's or Patrick's test. Can you bring this up here? And we're just going to apply pressure on the opposite ASIS and on the knee here, and we're going to push down. And we're going to do this on both legs to identify where the pain is located in the hip. And a positive test for this is if there's pain in the hip or inguinal region, there's going to be a hip pathology present. So the next test we're going to do is go ahead and slide your butt to the edge of the table for me. And we're going to have if this is her unaffected leg, she's going to bring this leg to her chest, up like this, and then lean back. Okay, yeah. And then if this leg were to come off the table, it would indicate some iliopsoas tightness. If this leg moves into an extension, it would indicate rectus femoris tightness. And if this leg moves into extension and some abduction motion, it would indicate IT tightness. Okay, so now can you roll over onto your side for me? And we're going to do the Eli's test. So for the Eli's test, we're going to bring her leg up like this, and if this hip should be on the table, and if her hip rises off the table, then it's going to indicate rectus femoris tightness. Okay, and then can you go ahead and stand up for me? And the next test we're going to do is the Trendelenburg test. So go ahead and face this way for me. Put your hands on your hips. And you're going to stand on your affected leg here and bring your unaffected leg up. Bring your knee up. And if this hip were to drop down, that would be a positive test for glute medius weakness on the affected side that she's standing on over here. Okay, so now go ahead and lay back down for me on your back. And we're going to do the hip scouring test. So we're going to bring our knee up like this. And we're going to apply downward pressure with some internal and external rotation. And we can do it here, up here, back here at different degrees. And with this test, for a positive sign, you're going to have pain in the hip region or clicking and locking. And that's going to indicate a labral tear or possible OCD of the femoral head or the acetabulum. And then the last test we're going to do is the piriformis test. So can you go ahead and lay on your unaffected leg for me? And keep this leg straight. And then with this one, go ahead and bend it right here. And then resist me pushing you down. So she's going to resist my adduction motion. And if that's painful, it's going to indicate a piriformis weakness. And that is a hip eval. Kayla does have hip problems. Thanks for watching.